loved your presentation actually, James, because you think you know it all about the product and the formulations, but it's nice to go full circle again and, hear it straight from, the maker, so to speak. And I think people don't appreciate how much would go into the creation of the formulation, and what just one point that I will take away from this is just explaining to our patients that it's every single polypeptide that has the technology to drive it deep.
Right.
And that in itself is one take-home message. But I think people would look at things and just go, "Oh, it's just another thing." And
yeah, it's definitely very difficult to make what we're making there, and of course you see a bottle, it's got ingredients on it. It's like, oh, it's a spray. It's just the same as everything else, and that now that the formula is patented, but not even just the formula by itself, but the way that we had to make the growth factors so that they were actually effective. So many of the stuff out there has been added. Even like look at Kerastase, right? Massive multi-billion-dollar company, right? That invests millions and millions and millions of dollars into hair research and scalp research. And they're doing plant growth factors in their, stem products that don't do anything, right? Like I think there's some hyaluronic acid in there that makes your scalp and your hair feel nice and soft, but that's about it. Whereas, when I started working on this, I literally started by getting research growth factors separately in a vial. And I was like injecting them into my scalp, like at different distances, and just to see if there was any real effect of those growth factors. And then when it came time to commercializing it, that's where it became really hard, because that's when it was like, okay, SH oligopeptide 1, which is like epidermal growth factor, right? You think in epidermis that would be very bioavailable, but because of the size of the protein, it's actually quite difficult to get it. So you end up having to look at it and go, well, the best I could do is 5 parts per million, and 5 parts per million means I might as well not use it at all, until we worked out a way to make 100 parts per million. And then once we did that, it's like, oh, now it can be used. It's one of the 7. Check that one off the list, and then keep on going down to the next one. FGF, whatever it is, like VEGF, go down the list one by one and work out what is the level that you need to reach in order for it to be bioavailable. And then can you concentrate the formula to that? And that's why it took so long, right? It's like usually things shouldn't take like 8 years to do, but we had to have the technology catch up to what the kind of the vision was.
Yeah, so as you say, sometimes it's worth waiting. It's worth waiting and getting it absolutely spot on and right before you deliver it. So congratulations on being patient as well.
Thanks.
I have a question for you. So you were talking about earlier, and I might have missed it, so excuse me, the in-clinic version and the at-home version as well. So are they exactly the same, James?
So the formula is identical. The growth factor formula is identical. So it's probably better to just give you the numbers, right? So we use about 10 milliliters of my proprietary growth factors. They go into the Keravive products, right? And so 10 goes into the spray, and it gets mixed with another 90 ml of solution. That's your spray. And then 10 gets divided, it gets split between the 2 9 ml boosters that you have. So the quantity of the growth factors and the types of growth factors, the polypeptides, the concentration before it goes into those 2 products are identical. The only thing that changes, of course, is the fact that one's mixed with 2 by 9 ml, and one's mixed with 90 ml to create the spray. But if you absorbed all of the 2 by 9s boosters, and you absorb all of the 100 ml of the spray over the course of a month, you're basically doubling up on the number of the growth factors that you're picking.
I have a question about the niacinamide. My understanding was in a home spray there is niacinamide.
Yeah, so there's three things in the home spray that are separate to the growth factors that are important. So the key is the patented growth factors, which are the 7 different biomimetic polypeptides. They are identical. The ratios, the concentration, everything is identical between the 2 products. What's different is what it's mixed with in order to create the spray, or in order to create the 9 ml booster.
Mm-hmm.
Now in the spray, like we don't have the advantage that we have with the booster, where you're getting vasodilation immediately, right? Because you've got the suction on the scalp, you've got the immediate exfoliation, then you have additional suction infusion happening when you're using the booster. So what I did was, for the spray, I added arginine, niacinamide, and copper tripeptide, 3 different and additional active ingredients to improve the circulation and some of the absorption when you're doing it without the HydraFacial. So that's why there's additional active ingredients in the spray versus where the treatment booster is just pure. We want it to just be pure growth factor, right? We want it to be as little extraneous product as possible. So the only thing we had to do is we had to thicken it up, if surprisingly, right? You know, usually with the way that we engineer these the growth factors, that I have a facility in Korea where we make them, and they come out like water. So like if you just had the growth factors, if you just had 10 ml of it sitting right in front of you, you couldn't distinguish that between that and water. And that was a goal, right? Because they have to be so small, so micronized, so they actually have the ability to penetrate. Now, in order to get that to be evenly distributed through the booster, you know, through the HydraFacial system, it had to be thickened up. So the only thing that we added to the booster is just a bit of thickening agent, just to make sure that you don't just have, like, you put it on the scalp and then all of it goes out. We want it to be able to be a little thicker, to be able to put it over a course of time, so you can complete the whole scalp, basically.
That's so interesting. That's really interesting. So it's nice to know that you're actually getting an in-clinic at home, virtually like for like, and it's not a diluted version.
Yeah, you're getting exactly what you get in the clinic is in that bottle. It's just stretch. We just stretch it out over a month instead of just getting it in one day.
Yes, and you know, to the point, you talked about consistency in the application, and you know, it's very simple. If you don't use it, you're just not going to get the result that you'd expect. And you know, I get patients that would say, "Oh, I've left the bottle in your clinic. Can I come and pick it up in 3 weeks' time?" And I said, "You can, but you're just not going to get the results you'd expect."
Right.
So
yeah,
that's really, really important.
Yeah, we noticed, like, now this is our data, but I'm sure HydraFacial has its own, but we noticed about a 50% difference between the people who were just incidentally using it and the people that were obsessively using it every day. So that would be the difference between, you know, seeing a 30% increase in hair growth to 45% increase, which is quite substantial difference.
So, you know, Bibin also asked that question, can you use it twice a day?
Yeah, you can. There's obviously a diminishing value of returns on how many times you can use it. Our goal was to have something that would last 30 to 60 days.
I see.
So if every spray is about half a ml, so you have what, you've got like 200 sprays that you could do. So if you did 200 sprays, you do it twice a day, there's your, you know, that you're now like maxing out.
Right, yeah.
So 2 sprays morning and night, you're going to run out at around approximately around about that month to just after a month.
Yeah.
So if you're using it properly. So
any top tips for girls, because I find it very hard to just give myself 2 sprays, especially to get it in all the areas that I want to.
Yeah.
Center,
so that's why we put the nozzle on it. So well, it has that like little the kind of extended nozzle. So what I tell most people is bypass all of this, right? Bypass all this and kind of spray it on to your scalp. So actually place the sprayer on the scalp and then spray and then rub in. And because otherwise a lot of people end up spraying their hair with it, and it's not a hairspray, it's a scalp spray. So we kind of cheekily did that by in the name, where we said it's a scalp stimulating spray versus a hair, because it really should be on your scalp. It's really, there's no point of being on your hair at all.
Yes, no, I completely agree. I tend to go one in the midline and then I'll flip it over and and I tend to draw a line.
Yeah, that's what I do. I usually just go one line here, one line in the center, one line on the outside, and then I just grab my fingers and kind of massage it in.
Yes, yes.
And we quite often we got those interesting questions regarding brows and beard.
Yeah. Well, okay. So a very important thing to note is that the hair life cycle on beards and lashes and brows is different, right? And so anecdotally, we've had people that have tried brows, and brows I'm a little less concerned about. Lashes, anything near the eye you want to avoid because you don't want to get arginine or niacinamide in your eye. And as far as the beard goes, people have been trying it. I think the people who have loss, and this is really kind of key, is that people who have beard loss, like I don't grow hair here, but I permanently removed it with a laser. So this is not like, but if you notice people who have kind of like patchy beards and they want to do it, it's generally better treated with a steroid, right? Because there's inflammation there that's restricting the blood flow and stopping the hairs from being there. So I don't think Keravive would work unless it's in a combination therapy where you're kind of treating the cause. If somebody just wanted to thicken their beard up, I bet it would work fine. But if somebody's like got patchiness, like they would have patchiness on their scalp, and they're thinking that Keravive is going to reverse it, you got to attack the problem first.
Underlying medical condition.
Yeah. And that's the hardest thing, right? And you mentioned it before when you had that patient that had the surgery, right? The one that and they just had this really, it was weird. It's like, well, I think they should have got a result, but they didn't. But then it came back. It's like there is always going to be, unfortunately, a variety of underlying things that we have no control over. And it's kind of like what I said at the beginning is that you want to take you want to get on top of the issue that is causing the hair to be thinner, unhealthy, and try and get on top of the issue. Once you get on top of the issue, you're free and clear, and you can Keravive all you like, and it's going to be a much bigger difference than if you don't do it that way.
I completely agree. And, one of the many principles of HydraFacial is, it's working from the inside out. And, for me, that's a no-brainer. With regards to that, we have a lot of patients, James, who are having monthly HydraFacials, for example. And I can see myself becoming one of those patients having a monthly Keravive.
Right.
Have you noticed or have you studied any differences between doing it just for the 3 months with the maintenance at 6 or versus doing it every month, let's say for a year?
No, we haven't. We again, I don't think there's enough people out that are trying it enough to give any kind of really good answer about that. But let me give you the technical answer or the physiological answer. There's no reason why you couldn't just keep on doing these every month if you could afford to do it, right? You can't overdo it, right? The biggest question would be not about the growth factors. It would be about having this aggressive kind of vacuuming of your scalp. But as long as you're giving it that 4 weeks at least, then that's plenty of time. That's not going to be an excessive amount of mechanical damage to your scalp. So I would say every week, forget about it. But every month, I don't think it would be an issue at all. But I think we're going to find out as more people try different treatment programs. As I said, I had to try and find a balance. I had to try and find something in the beginning that was going to be the dose of the growth factors was going to be enough that I was confident that we could get clinical results. And then once that dose of the growth factors, like X number of growth factors times 2 multiplied by 3, once I knew that quantity was enough, if that was infiltrated into the scalp, the key was then trying to work out the spacing, because I wanted people to be able to see results before their treatment course was finished, so that they would have more motivation to continue to use the spray, continue to come back for the treatments. Because what I found, and this happens a lot with people with hair loss, is that even for me, and like I designed the thing, I know it works, but like even me, and I'm looking at my hair in the sink, I'm so like checking in the shower, like how many hairs come out when I'm rubbing my scalp. It's mentally damaging to you, right? It's like it plays with your mind, especially if you're in a situation where your hair is thinning and you're going through that loss. Any like little like, oh, is that more double the amount of hairs that I had fall out last time? All of that stuff affects it. And what I found was once I went over that barrier to, oh, I can start seeing like, well, look at these hairs, they're growing like weird, or like I can see like I can kind of feel it's a little thicker, right? It doesn't feel as when I rub my hands through there's resistance there.
Yes.
And I'm like, I mean, I'm in the zone now, like it's working now. And that prompted me to be better at scrubbing my scalp, right? Doing the shampoo, doing the solution, and not worrying about, it seems silly because just because you scrub your scalp and your hair falls out doesn't really keep your hair in for that much longer. It will probably fall out the next day. But mentally, it's like, should I be rubbing my scalp like that? Can I keep the hair there? So that really played the biggest part in trying to work out the protocol, which was how can we space this so that when they get to the second treatment that they're like, you know what, my hairdresser says my hair's growing faster, or when I put my hand through my hair, I can feel it's a little thicker, or like I see less scalp, or the scalp is a different color, or I have less dandruff and things like that. Those are the markers that we look for in being able to go, yeah, this is working. Just stick with it. It's going to be better than this.
That's great advice. And one of the things that we see with our patients, well, you saw the hair metrics results were just much less inflammation of the skin, because you are, creating a good amount of lymphatic drainage. It's bringing fresh new circulation from the inside out. So where you have your proprietary, growth factors and peptides just going through the hair follicle, you're then having the soil around it that's in a much more better microenvironment. So the whole health of the head is in fact in a much better position than if you
look at the HydraFacial thing, right? It's that combination of exfoliation plus immediate vasodilation that you get, combined with some chemical, effect, right? Which is it's that combination that's key, and that's why it seems so crazy that we didn't think of it sooner, right? It's like one of those things where it's like, like we've been treating the face with HydraFacial and knowing the benefits for pigmentation, for knowing the benefits for acne, for knowing the benefits for collagen stimulation and skin smoothness and all those things. And it kind of seems silly that we didn't think about the scalp in the same way that we think about the face. And that was the driving force behind creating this, which was, hey, skincare companies have been doing a lot of really good stuff for a really good amount of time, and we have a really good knowledge about growth factors. And even now, you'll see with skincare that it's getting very specific. And my whole goal was kind of to leapfrog them, because I saw the direction that the skincare companies were going. And I was like, oh, I know I want to be there, but I want to be there on the scalp. And I think we can leapfrog them. So I think that this approach that we took with these multiple specific concentrations, specific selection of growth factors, specific concentration, specific delivery system, you'll find that will proliferate now into skincare as well. And I'm glad that we're kind of ahead of the game on the scalp.
Yeah, well,
we always have quite a lot of questions about comparison, PRP and Keravive, but you explained that very nicely.
You did. You explained that very nicely, and in fact, I think the two of them go hand in hand very nicely. And then we also talk about LED. We do a lot of LED therapy at the practice, and I'm sure there will come a point where that we will have a very nice FDA-approved LED device for the scalp. And the whole thing will complement each other perfectly.
Right. Yeah, that also helps you too with your when you promote it too, right? So the fact is that if you can get a red light approved for hair growth, which is there's plenty of predicates, right? And you just start to synergize that with the Keravive treatment, then now you have a hair growth treatment, yeah, the laser's doing the hair growth, but it's
Right.
it's still, you're kind of being able to bundle the two things together. One of the things that we found is that, obviously, just like we treat the face, is everything, it's in combination, right? Combination is key, and combination is where practices separate themselves from other practices, because they do understand that, oh, you know what, we put that neuromodulator in before we 2 weeks before we treat you with the laser, so that your muscles aren't fighting against, all of those types of things. Like, we use this post, or we combine, dilute calcium appetite with a collagen stimulating laser to do this and that. All of those kind of tricks are very relevant when it comes to the scalp as well, where it's like, this patient is androgenic, has androgenic alopecia. It needs to be on DHT, right? It needs to be on finasteride or Avodart or something. Now, if they can't take that, well, let's find a topical solution of that, so that they're getting some anti-inflammatory, like a beta dipronate, combined with a finasteride, or combined with in a topical version, that can go and kill off those weeds and stop that DHT from affecting the hair. And then we've got other tools, like we can immediately inject some PRP into the scalp to get the inflammatory and that wound healing response. And then we can go into Keravive as like a third step. So like work, and then the fourth step, maybe using a red light right at home to keep the circulation going. So, building that, that menu, right? It's like going out to a three Michelin star restaurant. You want to build like each one of those different pieces to build on top of each other. And I think we're still in the very early stages of what we think, what are going to be the best combinations. We just know that Keravive you can combine with anything. So, it's very flexible that way.
Yeah, no, it's going to integrate very nicely into the practice. And I do agree with you. It's still very, very early days here, especially because we had so much lockdown in the UK last year. But now that we have the data, we know it works. We've all felt it. We've all experienced it as a team. Our patients like it. That cohort are going to be key in supporting the growth of it at my practice, really. It's just about creating awareness. And I think girls in general, we probably may not talk to each other about the hair thing. We talk about other things. And it's just about just having that communication. And I think an area of interest questionnaire would be so useful for a practitioner to have if they don't want to elicit, hey, what's going on with your hair, or they don't even want to ask that question. So I say to my team, and I say to other doctors out there, just ask, just ask, and just start that conversation and that awareness. You talked about timing, actually, James, and to be fair with you, I think now's the time. I think the time's right. Everyone's stuck at home here. I'm doing so many Zoom consultations, and the one thing, because I'm more mindful of it now, I just look at their hair, and these women are stressed. They're stressed. They're schooling. They're at home with their kids. They're amazing women, and they've just finally come to this 1 year mark where you could just see them almost literally pulling their hair out.
Right. And the best thing is you could do this with your mask on. This is the best COVID treatment, right? Because like, what other things can we do? What other things can we do without a mask on, right? You can get hair removal and Keravive. That's about it, because without having to take your mask off. So
yes,
it is the right time. Time is now, right? So
it is. But thank you so much.
That was meant to be one of my questions. Why now? But we didn't have time for that.
Why not? Yes.
But we should do it again. Maybe, I don't know, maybe in Q3 or Q4, we should do it again. Maybe a slightly, of course, Keravive, but slightly different angle, maybe like a podcast.
Yeah, I'm more than happy to devote my time anytime you guys need it. As long as I can fit it into my schedule, I'm more than happy to do it. I love being able to interact with everybody. So
you both are amazing, seriously. Really appreciate your time. Thank you, James. Really
I appreciate your time and your support, and your like really, really the quantitative analysis, and bringing that from the medical perspective and from the physician perspective is key. I was telling Anda before you jumped on again, I said I don't like to do these things by myself. If I can pair it up with a physician that has real life clinical data, that's quantitative, that really cares about the science, I much prefer to have the two of us work together to do some education versus trying to do it by myself. So I really appreciate your time and being able to do this with you and meet you. this way. So thank you.
So thank you so much, both.
All right, guys, I better run. All right. Thank you. Have a good night. Bye.